Great, thank you, Raquel, for that. The other thing is that, there's many people you can see, we have a lot of people joining us today, so it'll be hard to do a lot of questions back and forth. But one of the things that we're gonna do is, because we wanna answer every question, because we learn from the questions that you bring us, we want you to put any comment, any thought, any question that you have about the content, the material, anything that you think of in the chat, because later on we're going to compile all our comments and we're going to record videos answering every single question, making reference to every single comment that you have in English and Spanish, so that we can bring it back to you. You'll have the videos, you can give it to the community. I think it's time to build resources among ourselves, and hopefully this will be a format that works for everybody. So it is an honor to be here today working with you. The work that you do every day, during this pandemic has made a difference. And we have seen now that our field is becoming more and more aware of the value of how we cannot do it without your work. But we also know that your work is tiresome, that your work is very demanding, and that we need to take care of yourselves. So this is why we're bringing you to seminars. Today, we're going to talk about tools that you can bring the community, that you can help people learn how to take care of themselves without you having, I imagine sometimes you work are carrying these backpacks full of rocks on your back, right? From all the community. But you keep carrying this around. So today we're going to show you how to not carry all those rocks, but let everybody carry their own rock, to give you the tools so that you can teach them. And the second session, which we'll be doing in Friday, will be all about you, how to take care of yourself, how to learn to say no, how to learn what barriers you face in taking care of yourself, because if you're not well, others won't be well. So we need you to take care of yourself before you can take care of others. So I can talk forever. So, I'm going to shut up right now and move on with the presentation. So just a disclosure, the work that Dr. Kanzler and I do is funded by the National Institutes of Health. And here are our funding sources. We already mentioned to you some of the bias that we have. For example, most of my work takes place in the Latino community. So a lot of the comments that I will make reference to my culture. That doesn't mean that we don't want to acknowledge every single group that is here, every background, every diversity, every contributor to diversity that you bring in. So hopefully with that in mind, and with your comments in the chat, we can figure out how to do this together. I want to acknowledge that a lot of the information that we're bringing you today is something that we developed together in collaboration with the National Latinx Psychological Association. Basic, simple tools to tell and to teach our community how to start thinking about mental health, how to start recognizing what mental health is, and how to start talking about that, because we believe we need to start from the most basic steps in order to help them and in order to relieve a little bit of that big load that you continue to carry every day. So here is a little bit of the agenda. Katie, do you want to take over the agenda?
Sure. So today we're going to be splitting into mostly two sections. Hopefully we'll have the third, but we'll be doing an introduction and kind of overview about our topic. And then we're going to be actually talking about what to do. So we're going to have this action part, the psychoeducation and coping skills. So that's pretty much it. If we don't have time for the questions, as Luz said, we will still respond through video later.
Wonderful, thank you. The other thing that we thought about doing, because all of us have sat through webinars and we get so bored, is that we're thinking of making it as a conversation. So, you'll see us going back and forth, alternating and saying, what do you think? What has your experience been? What have you heard? How do you cope with this? So hopefully that will make it more interactive to yourself. And as we do this, try to answer those questions yourself, what that experience has been to you, and share it in the chat for you. So that's why you see that we dress up kind of like the Pink Sisters so that you could recognize us easier on the screen. So what are the training goals and the objectives for today? Katie, would you like to take this ones?
Sure. Yes, so we're really excited about bringing this information and hearing from all of you as well. And of course, this whole talk is informed by what you've already shared with us through the focus groups earlier. So we'll be talking today about how the COVID pandemic influences our mental health in the communities. We'll talk through challenges and barriers, some that you have directly told us about. What are your barriers? We'll talk through coping skills and what to do and how to overcome some of those barriers. And we'll spend some time at the end going through some resources, and you'll have them to access later. And then next time, as Luz mentioned, it's going to be really fun to go through self-care strategies for you. So those are our training goals and objectives.
Great. Thank you for that. So let's start with the background and with the context. And I don't think, I think if anyone knows this better is you, right? Because you're in the front lines in the battlefield all the time. But how can we summarize how does the COVID pandemic is affecting mental health? And I like to make reference to, the Maslow's hierarchy of needs that kind of help us identify, what are some of those basic things that people need to thrive, to grow, to achieve their best potential, to become the best they can be. And according to Maslow's, it progresses in a series of steps or layers, right? At the very bottom, we have what is our basic needs of having food, of having shelter, of having, a place where we feel safe. And then as we start meeting those needs, in our development, we start progressing to higher level needs, achieving an education, building our interpersonal relationships, and really discovering how we can become the best persons that we can be. Well, unfortunately, this is very hard for our communities, right? I have had friends who are teachers who says, how can we teach these children when they come to school and they're hungry? Or when they come to school and they're afraid, they don't feel safe. They're afraid that their parents are gonna be deported when they go home, or they're afraid they live in dangerous neighborhoods, so they don't know. We hear these from our Black brothers and sisters all the time. They're walking to school, they don't know if they're gonna make it back or not. It's a very scary times we're living in. So I invite you, as you work with your people in the community, use this pyramid to think, where is it that they're at? Have they met their most basic needs? Because if they haven't, we need to start from there, right? How do we build them up? How do we empower them to build those basic needs so that eventually when they feel safe, they can move up to become the best version of themselves? And a lot of the framework that we're going to give you today can be summarized on the phrase, teach them how to fish. Do not give people the fish. And the goal for that is because if you teach them these skills that we're going to talk about today, you'll help them build resilience. You'll help them learn more of who they are, of where they come from, and where they're heading, so that they don't rely on you or someone else to resolve their problems, but they get to know a little bit more about who they are, what their needs are, where they are in this pyramid, so that they can move forward in life. So hopefully that's our goal, and we'll be carrying this theme throughout today. So how can the COVID pandemic affect mental health? Katie, if you would like to take this slide.
Yes, thanks, Luz. So a lot of what we're going through on this slide is directly informed by the feedback that everybody shared in the focus group. So how are we seeing this pandemic affect our communities? So one thing we heard over and over again was health concerns, right? Not being able to access health services, or maybe even struggling once you have to communicate and understand exactly what's going on and what to do. And that affects your mental health when you're not able to access care, or it's not good care. And so we know this is happening in our communities. Anything else on that, Luz?
Yeah, no, absolutely. I think a lot of the way in which, how has this pandemic kind of affect our mental health, it's hard to put it into words, right? But we have faced uncertainty, we have faced fear. You know, a lot of our people don't even think about, well, if I get sick, what's going to happen not only to my health, but what's going to happen to my job? If I don't work, I don't eat. But they don't necessarily connect how that is affecting them mentally, right? How it is affecting the instability of maybe not having that not meeting that lower layer, right, of having basic shelter and basic housing. I see a beautiful question on the chat that said, would you think that it would be better to learn how to fish on a full tummy and not on an empty tummy? Absolutely. Yes. Right? Is it the ideal for their communities? They sometimes it's not, right, because they don't have it. But I think if we teach them with a lot of kindness and patience and the little steps by listening, we'll talk more about this. I think they can empower themselves to learn even how to thrive with an empty stomach. Because unfortunately, the realities of our communities, a lot of the times, they're going to go through ups and downs. And you're going to go through that with them.
And Luz, don't we talk a lot too about what we can change and what we can't change? And there's so many things that we cannot change right now that are so difficult. And so a lot of this is recognizing what's going on, what are the barriers, how we're affected, how is our community affected, and then what can we change, what can we work on?
Yes, absolutely. And this is where the empowerment becomes so important, right? Mm-hmm. In that no one can take away those values or those strengths that you have. You carry that with you. You have carried out throughout your history. So hopefully with some of the things that we'll be talking today, you'll be able to bring out that in people. You will help people recognize what is that makes them who they are. What is it that they're carrying in their veins? You know, who they are. How do they describe themselves? How do they describe their ethnic identity? You know, their multiple intersectional identities.
Yes. Something else, just to look at this next bullet that came up, something else that has shown through in this pandemic is irritability. And we had a good conversation with Michelle too about what is irritability. And I think about it sometimes as being annoyed, you know, just like everything just gets on your nerves. And I know, Luz, you had such a nice way of explaining it in Spanish when you talk about being irritable and what does that mean?
Yes. Estás de malas, no te aguantas ni tú mismo. It's like you cannot stand yourself. You know, it's like you're your worst enemy, you know, and you're going to fight with whatever you have in front of you.
Yes. I just love that. You can't stand yourself sometimes, and then you can't stand everybody else. And it's just unpleasant. But that's something that we hear is a struggle right now. It's very normal right now to be irritable, and that can affect your relationships. That can affect romantic relationships. That can affect family relationships, friendships, work relationships. Again, it's normal, but it is, you know, it's a problem too. What else is on this slide here? To even past irritability, then we have even deeper, stronger emotions that people are struggling with right now. Yeah, shame, guilt, blame, despair. And it's not just the emotional too, like mentioned, it's the thinking.
Yeah.
It's the thoughts.
Absolutely. You know, remember, Katie, when we were hearing in some of the focus groups, a lot of this information came from you. So when you participated in a focus groups, you told us what you were seeing in the community. You were saying how many parents feel frustrated. I mean, imagine you have to go to work, or all of a sudden you're home and you're not very proficient in English and you have to help. All of a sudden you become the teacher of your children and you're not doing a good job, and all of that. You lose your patience, you start screaming to your children. And that's when a lot of the shame and the guilt and the blame comes into place. So our lives have changed. And with that, it has pushed us to our limits, you know. And that is a lot of the ways, you know, a lot of what Katie was saying, that is affecting our mental health.
Mm-hmm. Yes. And a natural kind of consequence of that too is sometimes we disconnect and we numb because it can feel so overwhelming. And I think the next bullet too is about avoidance and disconnecting and numbing are all related. And it's not really a bad coping skill in the sense of, it's natural. It's normal to want to disconnect. It's like you're in pain, you want to pull away. Nobody wants to feel pain and feel shame and discomfort and depression. On the other hand, we know though that if we disconnect too much and we numb too much and we avoid too much, that is not helpful, and it can make everything else so much worse. And we as humans, we are really good at avoidance, right? I know I'm really good at avoidance. This is easy to put things off. I don't want to think about it right now. I don't want to, so we're very good at that, and it's coming out more right now during the pandemic. And that goes to this other point too about changes in routines. Just even waving your hand or putting in chat, whose routines have gotten really, really, really messed up? Like your sleep routine, your work routine, your care for your family members routine, everything, right? Yeah, I see hands, yes. And the compounded, yeah, the compounded stressors too, right? Luz, you mentioned intersectionality. We wear different hats, there are different identities and different roles too. And this example is immigration. If you're worried about your immigration status or the status of a family member, plus all the other things that we've described, I mean, that's a real compounding type of stress experience. And many people in the community are dealing with these compounded kind of stressors. So any other thoughts on that? Or I know I haven't asked Raquel or Michelle too, but are you stressed? Are you seeing this as well?
Yeah, I think another compounded stressor that has been at the forefront for us right now is a lot of the violence that has been felt by our African American community, right? And I think they have brought it to our to a sounding board, saying, we're afraid of going out, we're afraid of sending our kids to school. If my kid is coming late from school, I mean, did something happen to him or her? So I think those are additional stressors that our people already were dealing with even before the pandemic, right? Yeah. So add that, all of the things that Katie just mentioned, and it becomes a time bomb. I call it the snowball, right? You start with a little one, and then you start more and more and more until it becomes so big that it becomes bigger than you. And there you go with your backpack full of rocks.
Yes, you're so right, Luz. Yes, things, police brutality and discrimination and racism, things that were already here and already dealing with, and now everything else. It's a lot.
It says that it's overwhelming, and then in the chat box has been saying like sleep routines change because of this. Anxiety is also fears, all this overwhelming situation, right? That it is now that we face every day, but I think just stress and anxiety, right? And sometimes those feelings and emotions that that is sometimes easy or sometimes not easy to share, right? That is also overwhelming.
Yes, absolutely. I mean, there's so much activity in the chat right now, so thank you so much for that. But it sounds like that's very negative, right? I want to emphasize, and I want to look at the other side, because you also gave us an information, and you also gave us the summary of how our communities are still managed to thrive in the midst of this pandemic. So we know we're struggling, but we also know that our communities get up and know how to stand up. When life put them on their knees, there's no one better than our communities to get up and keep walking. So, but how do we make that process easier for them? And one of the things is to facilitate information, to facilitate them access to knowledge, to ways, to finding ways to learn how to fish. Here we go back with the fish, right? So for example, oops, I think I just lost my screen. Oh, I got it back.
It's okay. We have an hour from now.
Oh, perfect. Oh, I have to scan a little bit. My computer is acting up today. Here we go. So what are some of the big barriers that our communities have faced in addressing mental health? The first one is fear and mistrust. You know, our communities are having a hard time trusting where to go for information. Information has been so confusing to them that they no longer know, is it valid information? Do I do it? Do I not do it? And this is where your role becomes essential. Why? Because they trust you, because you're one of them. So this is where your role in working with the community is key. And I think our field, you know, the medical field, the mental health field, is waking up to this, to really truly value what community health workers and promotoras de salud and líderes comunitarios can bring to our people, because you're the best way in which how we're going to overcome fear and mistrust in years to come as we navigate ourselves out of this mess that we're in right now. There is also a lot of shame, guilt, and stigma when we're talking about mental health. You know, we're not very good, and we notice this every time we run focus groups and we ask, so what does stress looks like to you? People cannot put it in words. They tell us stories. They tell us how, you know, what is the neighbor struggling with, what they have seen, but it is so hard to talk about how they feel. You know, even if someone says, I feel broken, sometimes just admitting that is a sense of shame and guilt. And I think that's where you have the power to change that way of thinking. This is also where your role is going to become so important in helping us fight the stigma that for many years, psychologists and doctors, we have tried everything and we have not been able to achieve that, because they need people who knows. They need people who comes from the community, who understand it, who have experienced them themselves to be able to do this process. The other one is because we have very limited knowledge and information, as I was mentioning before, you know, and whatever is there, sometimes it's not appropriate. A lot of the time, cost and money gets in the way. You know, sometimes accessing mental health services is very expensive, particularly if we go back to the pyramid, right? When you're not meeting your basic needs on food and shelter, guess where your money is gonna go? Your money is gonna go to eating. Your money is gonna go to putting a roof on your family. So a lot of the time, this gets pushed back. So maybe it's time to work with you together to find other ways to bring mental health interventions, other ways to bring information to our communities. And this is our intent to do so.
And Luz, I want to echo that. I mean, there is nobody better to help break down the barriers of stigma and shame in seeking help than the people in the community. I mean, it's just the only thing, I think. So it's so amazing we have so many people here to learn this information, to bring it to their community members, because you're the key to helping this become normal. Normalize it. Normalize talking about stress. Normalize talking about depression. Normalize talking about feeling anxious.
Yeah, absolutely. And this is, but also we need to take care of yourselves. Yes. And this is why the second session that we're going to do on Friday is so important. Because if you're not well, if we don't take care of yourselves, how are we going to help our communities? We can do it. Our fields have tried to do it for many years, and we're still in the same place. We're not overcoming stigma. We're not overcoming all of these barriers. The language barrier is another huge one. We're not even starting. So we realize that we need you, and we need to create programs to help give you the tools to do this. Also, our people are busy, you know, they have busy schedules. Many people work 2-3 jobs, you know, they have problems with transportation. So sometimes, you know, it's not as easy to go and access services. A lot of the time, services are far away from where they live. So we need to think as to how can we bring the resources and the services to them, like I was saying, maybe in ways that is not traditionally. So we're going to move into the fun part, the second part, what we'll be talking about in terms of what are some of those very basic skills that you encounter when you encounter people in your community. This is what you can unpack. This is how you can take the rock out of your backpack and give it to them so that they can learn to learn themselves better. Katie, would you like to take this slide?
Thanks, Luz. Yes, I love the first bullet here, be flexible. That's just the key right there in working with the community and working with people. You have to be flexible, right? How many of you have had a plan where you thought, I'm going to meet with, this member, this patient, and we're going to talk about this, this, and this, and we're going to do this, this, and this, and then you arrive and it's not, something else is going on. There's a crisis, there's a new thing, right? You have to be flexible. We have to be adaptive. And taking all the skills that you have and all the skills you'll learn, it's good to have many skills so that you can be flexible. So you don't just have, one tool, and you want your community members to also learn to be flexible. That's a key to psychological health, is being able to, reroute yourself from plan A into plan B into plan C when you need to. Luz is going to talk more about establishing trust, I think, in the next few slides. Trying to understand people's experiences. Well, another word for that is empathy, right? Just imagine you are in the shoes of the family you're working with, of the person you're trying to work with. So what's it like for them? Really getting into their shoes, into their head, into their context, and understanding that's so important. Luz talked earlier about safe environments and safety plans, right? How can you help somebody, with those things on Maslow's hierarchy that are higher up when they're not feeling safe, when maybe they're in a domestic violence situation, or there's another safety issue at home, there's risk in the neighborhood, things like that. What can you do to help the family or the community member be as safe as possible? That's critical. Psychoeducation, we'll talk about that. And Luz, I think this is a word that sometimes people misunderstand because it says psycho on it.
Yep.
I just think about it as it's education that is psychological in nature. It's for your body and mind, but it's education. So we'll talk about that more. And coping skills, we're going to talk about that more too. And finding strengths. This was already mentioned. All of you and all the people you work with have so many strengths. So how can you pull them out, help people to recognize their strengths, and then build on those strengths? Nobody's starting at zero. Everybody has strengths already. And then the support system, we'll talk a lot about that too. So accessing resources. Again, you all are in your communities. You have great knowledge of the resources, and the more resources you're aware of, the more you have this ability to pass them along, like Luz said, so that others know how to access them and how to fish. And self-care, we'll talk about that a lot more the next time we meet on Friday.
Wonderful. So this is just a summary of the things that we're going to deep a little bit digger. So now, establishing trust. No one knows it better than you, ladies, because you do have the trust of your people. You do have the trust of your communities, right? You're embedded in it. People come to you, and sometimes a lot of them, and you feel overwhelmed. But sometimes the tricky part is not so much gaining that trust, but it's maintaining that trust, right? So what is it that you need to do to keep people trusting you? And I would say the number one is that people need to be heard. People want to be heard. And what does that mean? And how do we do it in a way that is effective, right? Because it doesn't mean that I'm going to sit here and listen to a story for 30 minutes and then the person will be heard. So we have something that is called the mirror. I love the mirror. And basically the mirror is when a person tells you something. If a person tells you, I'm not feeling very well, I feel very stressed, I feel very, very fatigued lately. And then you say, tell me a little bit more about that. And the person goes, well, I'm not sure how to put it into words. Then you take out your mirror and basically is saying back what you heard to that person. So what you're going to say, well, I just heard you telling me that you're having a hard time keep going. You know, you sound like you're having a really hard time right now, and that you don't know how to put it into words. How can I work with you to help you explore what that is? And then, you know, because a lot of the times we haven't heard ourselves. So it's so powerful when we hear another person saying what we just said, and there is something very healing and empowering about feeling heard. So I encourage you to develop any listening skills that you can, to learn as much as you can about some of the techniques that you can use to help your people feel heard. The other one is sometimes, you know, because of the sake of time, we're in a rush, you know, we want to get the information, okay, you know, and we kind of corner people about telling, well, tell me what is the problem. And a lot of the times people might not be ready to disclose that information, right? It's very sensitive. This is usually the case, for example, in domestic violence, when there's a lot of shame, or there might be guilt, or there might be cultural taboos that the person, we have this with people who have had COVID. There's a lot of shame in having COVID. You know, people in our groups, you told us that sometimes people feel like, well, maybe people are gonna think that I wasn't complying with the regulations, or that I was partying out there and I was not being self-conscious about other people, and I feel shame, you know. So giving people the space to disclose to you that private information when they need it the most is going to help you regain that trust. So sometimes all you have to say, you know what, today let's just be present with each other. If you don't feel like you want to tell me everything that's going on with you right now, it's okay. I'm just here for you. I only have 10 minutes, you know, because my day is busy, but let's just be present with each other without having to talk about anything else. And that in itself creates a lot of healing that can be very helpful. People are acknowledged for seeking help. This is something that we're having a lot of trouble lately in our world. We don't hear a lot of acknowledgement and a lot of praise for other people, right? We're not told, wow, you know, you're doing great. Thank you for looking for help. It's such a sign of strength. So how can we do a little bit more of that? And the minute you start doing that, the minute you start giving people kindness and acceptance, you become a magnet. Now, I don't know if you really want to become more of a magnet than you are already, because you know your workload will double. But I think there's something very positive about that, and in helping establish trust in our communities. People's experiences of hardships are validated. Sometimes, you know, even without being aware, we tend to invalidate people's feelings. You know, for example, I have a sister who has multiple sclerosis, and sometimes she comes and she says, I don't feel good today, you know, I'm having a hard day. And I was like, no, you're strong, you can do it. You know what I just did there? I completely invalidate her experience, right? Rather than say, I am so sorry, I hear you. This day is very hard for you. How can I help you? So we need to, yes.
That's such a good point, though, what you're saying, because when you see people that are struggling, whether it's a family or a friend or community member, you want them to feel better. You don't like to see them in pain. You don't like to see them struggling. So it's so natural, isn't it, to say, no, you can do it. You're strong. You got this. But sometimes just reflecting back is so much more powerful, right? It's so validating.
Yeah, absolutely. The other thing that we do all the time is give advice, right? And we don't know, first of all, how that advice is going to be taken, or, you know, the things that might work for you might not work for other people. And imagine, let's say you give advice to someone who says, you know, I want to lose weight, and you say, well, you need to go on a caldo, on a soup for the rest of the week, and you'll see how much. What happens if the person didn't do it? Next time they see you, they're going to avoid you. Because it's a shame. They're going to say, did you do what I told you to do? Oops. I would avoid the person, you know, because I know where he's going, right? So sometimes giving advice is not the idea. In this, we go back, right, to teach them how to fish. Help them to find what is it that they need to do to thrive. to become the best version of themselves, rather than you telling them what to do, rather than you telling them how they're supposed to feel, how they're supposed to think, how they're supposed to behave. That helps you maintain the trust.
Even when you might know the best possible thing for them to do. You know, it might seem so obvious to you, right, Luz? Doesn't this happen sometimes? Even as a psychologist, I think, oh, I know what they need to do, exactly. But if I'm just telling them what to do, that's not helpful. You know, that is not helpful. It's so much more helpful to validate, to encourage, to listen, and work together on a plan, but not just telling someone what to do. And it's very hard not to do that sometimes.
Yes, absolutely. But you know, we all have people in our lives all the time that are telling us what to do. Yes. How refreshing it is to find someone who's going to help us recognize and values and helps us learn patterns of behavior, how to think, right? How to learn. You will making a difference on people's life. So the other way in which you maintain trust is by bringing them resources. But sometimes, you know, we bring them and we highlight, this is what you need to do. No, let them read. Connect them with the resources. Maybe give them a website if they have access to technology. We know our communities sometimes don't, right? But if they don't, print out those sheets, give it to them, make them read them, and then ask them, I'll set up a time to talk to you and let me know what you think about that. You will learn so much from that person in just seeing what they learn about what they just read. You're empowering them by giving them that ability to learn by themselves. Yes, you give them the resource, but they're supposed to get back and talk and discuss and think. This is just put the example of our chat here. I mean, as I'm going through, I have divided attention because I'm looking at your excellent comments that are guiding our discussion today. We learn from each other. So in you giving them the resources that they can explore, you're contributing and helping them to get to know themselves better, to get to know what is happening to their mental health. People appreciate when you don't need to be or appear as the expert, you know, and hey, all of us working with the communities, you know, I bet Katie, you experience this too, community health workers, when we feel like, oh my God, I'm supposed to know everything. People look up to me. It's okay to say, I don't know. But if we work together, we could figure it out, you know, and becoming real, you know, and getting rid of all that stress and you know, I love positivity. I think that's an aspect of positivity, right? Humbleness, and be able to say, I don't know, but we could figure it out if we work together. Another one, right? It's gonna be very hard for people to trust you if you don't practice what you preach. And, you know, I can say I am the biggest sinner of that, because I'm going to tell you so many tips here. And sometimes I don't even take time for myself to learn to go through them, right? So if we're going to tell someone, take time for yourself, we need to do that ourselves first. Because in doing that, we're going to learn what barriers we have doing it, what challenges, you know, we learn tips to do it better, you know, tips to do it more often, and all that knowledge, you're going to go back to the people and say, you know, I don't know if this will work for you, but this worked for me, you know, and let them decide if they want to try it or not. But there's something very powerful about practicing what you're trying to teach the people. And the other one is humbleness. You know, I just mentioned, right? The acknowledgements that we're not perfect, that we're all in this together, that we are all struggling no matter what. We put a lot of faces, and we see this in our social media, right? People appearing happier than they are. Life has ups and downs, no matter what. If anything, life will bring everybody to our knees at some point or another. It's how we get up from it. And it's acknowledging what you have to do to get up that makes you stronger and that helps you build a better mental health. But you have to have a humble approach to life that's saying, yes, I've been in your shoes and I'm sorry. And I might not fully understand your experience, but I'm trying my best. That will get you a long way to maintain the trust with the people. Any comments that you have, Dr. Romero, Raquel or Katie?
I think it is very important with the point that you mentioned that life has ups and downs. So this is part of our life, and it's going to be a part of our daily situation, right? Daily life. But if we share with others with trust and with kindness what we have been through, that also helps with empathy, right? And feeling this support. And by listening others is going to help to sharing those and continue building this respect and this trust through this time. So working together through these educational sessions, I think is empower us to validate what we're feeling, right? It's part of the life.
Absolutely.
Raquel, I like what you said about the kindness, having kindness. We don't often have kindness to ourselves.
Yes.
You know, and that's something that we can model. You can model this when you're talking with people and being kind to yourself instead of saying, oh, that was stupid. Why did I do that? You know, those little things we say sometimes are, oh, how could I, you know, not saying those things, being kind. It's so much easier for us to be kind to others, and we're not often kind to ourselves, but we can teach other people to be kind to themselves when we're practicing being kind to ourselves, which is really hard.
Yeah.
You know what, wanted to ask too, are the slides available? I've seen people ask that a few times.
Yes. Yes, they will get the slides available. And even beyond the slides, you know, we're like a little turtles because we have so much work, but we thought about this recently. We want to put a booklet together with all these tips, with forms that you can use for yourself or for the community as we go through the next steps, how to identify your symptoms, how to identify your triggers. Very basic information. So hopefully we will come and bring you this booklet. You know, we don't know the time frame, but we will work very hard to give it to you so that you can have all of that information in your toolbox to use when you work with the communities. So let's move on. Let's move on now to education and coping skills. Katie, you want to take it from here?
I do. I was saying, now people are going to expect the booklet. We were talking about it.
We're done. We have to do it. Yep.
All right. Yes. So priorities. I know that most, if not all of you, have probably been working with people for a long time, and you probably understand some of the things we've already been talking about. But just even as a refresher, this concept of setting priorities is so important, because when you're working, especially in communities with these compounded stressors like we talked about, where do you start? This person has 500 things going on. It's overwhelming. You know, it's overwhelming to them, it's their life. It's overwhelming to you as the person trying to help them through that. So setting priorities and asking someone simple questions like, what is the number one thing I could help you with today? What is the number one pressing issue? What is most important to you in your life right now? And that will really help. It doesn't mean that all the other things on the list aren't important, but it will help focus your time. It'll help you be effective in using the time that you have, because you're working with a lot of people, not just that one person in front of you or that one family. So asking the family, what is most important to you? What can I help you with today? Or what do you want to work on the most? Questions like that are so helpful, because people often, they don't even know, they haven't even thought about it. It's just like, I don't know, my life's a mess. I feel terrible. I feel horrible. My health is terrible. Parenting issues are difficult. I'm dealing with microaggressions every day. I love that comment someone threw out. Yes, people are overwhelmed with so many things. Where do you start? So asking them, what's important to you? What's most important to you? And what do you want to focus on now? And that will take some of the burden off of your shoulders too, of feeling like, there's so much going on here. Where do I start? You can talk about it together. So it's a simple thing. Oh, priorities, but it's very powerful. We'll talk a little bit more about values later too.
Yeah, it's about taking those rocks, right, from the backpack, exactly what you were mentioning. Let's pick one rock at a time rather than carrying 10 or 20, you know, and sinking on it. And I like to make 2 points about this. And this, I think this is the beauty of the chat room and of the focus groups that we run with you. We did not think about this. This comment came from one of you in one of our presentations before that says, I think the best thing that we need to do is to help people identify priorities. And we're like, ding, 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 ding. Oh my God. So I ran to Michelle and I said, that becomes our number one.
Yeah.
So do you see how we need you to work together to inform what we do? So this is essential. The other thing, that I would like to say is go back to the pyramid. If people cannot really put it into words, like Katie was saying, show them the pyramid and see, where are you? And within each layer, what does your main need looks like? So that you can work and help them with the thing that's stressing them the most.
Mm-hmm.
So another thing that is huge, and we have, and I can speak on behalf of the Latino community, which is, and myself, I'm Latino myself, is we have a lot of trouble recognizing and validating our emotions. People can say, how do you feel? And we said, I don't feel good. And that's it. But tell me a little bit as to what that looks like. I no sé. I have no idea. My stomach hurts. Okay, what else? What do you feel? Oh, but on the other hand, if we ask other people, they will tell us, you're in a bad mood all the time. You're mean, you seem angry, and you're like, how do they know how I feel, right? But you can describe it yourself. So one of the key things to help people in your community when they tell you, I'm not doing good, I'm feeling stressed, help them recognize their emotions. What is it that they're feeling? And sometimes we have a very, either we're sad, we're angry, or we're lonely. And sometimes that's all we can point. But if we look at our phones, we have emojis for every single emotion, right? And pediatricians use this all the time to help children identify how they're feeling, and then the kid can point out, and we can put it into a word as to what that feels. So maybe one of the things, Katie, that we can do in that booklet is add some of those emojis with labeling emotions.
Yes.
And what it takes is for a person to sit maybe 5 minutes in silence and think, so what do I feel? What is this that I feel? Because depending on that insight is going to guide you in terms of what do you need to do to make it better. So, which takes me to the next point, right? So once you get your emotion, we're very good, for example, if it's anger, and if you're, let's say, a Latino woman, sometimes I'm not very ladylike, right? So it's like, oh, I shouldn't be angry, especially if it's towards our parents. That's very disrespectful. So I shouldn't be feeling that. And then we start what I call, I was using the analogy yesterday that we have an angelito, an angel here, and a devil on the other side. And the voice of the little devil starts going, oh, you're a bad person for feeling that way. You shouldn't be feeling that way. Shame on you. And it feeds up until we feel like a roach. We feel so bad, right? And instead of just saying emotions are normal part of life. We were gifted with emotions when we were born. The difference is what we do with our emotions, right? Because we can channel those emotions, even those that are negative emotions, in a positive way, and learn to work through them, or we can destroy ourselves and others if we learn to channel them in the bad way. But the beginning starts with recognizing, with knowing what it is that we feel. And the other one is to think, well, where do they come from? A lot of the times, when you ask people, they're like, I'm not feeling very well. Why? I don't know. And I think this goes back to Katie's points of priorities, right? So what's happening to you? What's making you sad? What's making you anxious? What's making you fearful? Or the opposite way, what makes you happy, right? If the person cannot put the bad parts of it, find them the strengths by asking them, what makes you feel joy? What is the difference between joy? All those questions help people gain insight about themselves, help people know who they are, and help people know where they come from and where they're heading to. So it's really important in helping people learn to recognize how to do this. The other one is important to help people normalize their emotions within the context, right? Once they understand where they come from, it's about maybe telling people, well, if I was in your shoes, I would probably feel the same way, right? So let's say, for example, you know, if my kid didn't call me and I'm waiting until 3 in the morning for him to call me back, I will be very angry. It doesn't mean that you're a bad mother. It means that it's understandable what you're feeling, right? So try to normalize that emotions are a reaction to something that makes you upset, and help people understand how the process comes. And the other one that is very, very important is that when we understand our own emotions, we become more tolerant and more, as Katie was teaching us, empathic towards other people. We have more compassion because we understand what it feels like to be in or to feel in a certain way. So I invite you to start there by helping people find out and put it into words, what is the emotions that they're dealing with, that they're struggling with, they have a difficult time, so that you can then move on to use the next skills that will give you to move on. Katie, you want to take the next one?
We have 30 minutes left.
Thank you, Michelle.
Thank you. Yes, building on what Luz shared, you know, it is sometimes hard to identify what the emotion is. I love the idea of use emojis. So use anything you can. I saw someone wrote about the Baker-Long scales. Yes, whatever you can grab a hold of. Something else that's helpful though is to think to more than just your emotions. The emotions are huge and sometimes the most obvious thing. But also there's your body, there's your mind, there's behavior, and stress comes out, you know, in all of these ways. And it's different for everybody. So I wonder, you know, well, not I wonder, I recall some of the things we learned from the focus group feedback and the surveys, you know, that people talked about their behavior changes. They've noticed people in the community, maybe they have an extra cerveza, you know, things change in how we behave. Sometimes people don't even notice their thinking's changed or their body's changed or their mood has changed, but they're acting differently. They're smoking more, like it says. They're not interested in sex anymore. They're not sleeping well. Like sometimes it comes out in your behaviors. Then stress, sometimes it comes out in your body. Like Luz said, that's very common, that you might not be very aware, but suddenly your stomach hurts. So you've had a migraine headache, or you know, and so helping your community members and yourself identify what are my signs of stress? How do I know when I'm stressed? This is so important because once you get to know your signs of stress, you can start to prevent them, and you can start to do something about them once you realize they're there. It's sometimes the body or mind or emotions, it's waving a big flag to you. Something's wrong. We need to fix this. And helping your community members be more aware of how stress affects them is just very critical in this. So if anybody wants to throw anything in the chat about how you know when people are stressed, you don't have to say it about yourself. How do you know other people are stressed? Feel free to throw that in there because it's different for everybody.
Yeah, by helping people, right? I mean, you can just planting these thoughts in people's head to start making a list. Make a list, because anything that can be measured can be managed. So if they know they're having a little bit more of stomach aches or headaches, well, the symptoms of stress are going up. They need to manage it before it gets worse, right? And I say we, but our Latinos are perfect at describing the body. You tell them, what are your symptoms of stress in the body? Oh, we say everything. Nos duele la panza, we feel butterflies, we feel dizzy, but we're not as good when we're like, so what are your mental symptoms of stress, right? What do you think? Remember the little devil that we have, that little voice? What is that voice telling you when you're stressed? Is that voice telling you, oh, you won't be able to do everything that you're supposed to do today? You don't have what it takes. You're not good enough, right? So when we're stressed, all that negative voice starts becoming louder, right? Emotions, we go back to slide 1, right? When we're saying learn to validate and recognize our emotions. And as Katie mentioned, the behaviors. What are your behaviors? Are you sleeping less? Are you sleeping more? Are you eating more? Are you eating less? You know, I know for me, for example, is I can gobble an entire bag of M&Ms when I'm stressed, and like there is no tomorrow. But I know when I'm doing that behavior, I know that's a symptom of stress. Now the problem is stopping, right? But,
That's a different issue.
that's a different problem. Yeah, but helping people to identify the symptoms of stress is essential. The next one that is important so that you can help people to identify is what are some of those triggers of those symptoms of stress. So what makes those symptoms of stress better or worse, right? Some people in the groups that you did with us told us the news. The news has been a huge source of stress for many people during the pandemic. The political environment was a major source of stress. Seeing all the images constant of violence, people being victimized, a huge source of stress. So what do you do when you identify a trigger? If the person starts knowing what are some of those triggers, then the person can retrieve and maybe, okay, for today, I'm not gonna watch the news. I know my symptoms of stress are very high. I'm gonna take the day off from that and from social media. Or I'm gonna take a few hours until my symptoms start subsiding. So in getting to know what triggers them, people will be able to manage and reduce the symptoms of stress. Another one that, and this one is particularly sensitive to talk about, is our family. Sometimes our triggers us our own family, and that's really hard because we live with them, right? Sometimes we cannot stand the husband. We like them sometimes, but at certain hours of the day, when we fight for the remote, for the TV, or where they want dinner and you're so tired, we can stand them. Sometimes we can stand our children or our parents or our wives, sometimes the husband comes really tired from work and, hi, the wife wants attention or wants to talk and the poor husband just wants quiet time. So what are your triggers? And it's hard to acknowledge that, particularly when family is supposed to be the place where, family is not supposed to be your trigger. So there goes the negative voice around. But it's so important because once you recognize that, for example, you can go to your family and says, you know what? I love you, but today I'm having a tough time and I need a little bit time of myself. But you need to know what your trigger is so you can address it. If you have days where you didn't sleep, sleep is another one that kills me. If I don't sleep by 8 days, I know I'm not gonna even be able to speak English. So how am I gonna do my work? So what are your triggers of stress? Eating. If you go starving all day, or if you binge eat all, the day before that you feel your stomach is so sick, what are those triggers for you? Any comments, Katie or Raquel, that you have in that regard?
I think it is, maybe I'm in that you wake up in the morning and or early in the morning, 3 a.m., 2 a.m. and like with this anxiety, with this, and I say, I cannot sleep. Well, probably it's because part of the stress, right? Is like, okay, I need to go back to sleep because things are gonna be the same in the morning. So better to start recognizing what are the symptoms that you mentioned and start working with yourself to start feeling better, right? It's very important, the recognition of the symptoms. Mm-hmm.
Yes, absolutely. Katie, here is one of my favorite slides. Take it and run with it.
One of my favorites too. I just love this topic so much, the concept of values and how important they are. We know from personal experiences and from observation of other people and from a lot of scientific research that when people stop doing things that are important to them or meaningful to them and they lose sight of their values, that they don't do well, that they get depressed, that they get anxious, that they suffer more from all the stress that they have. And so for me, if I was in my office right now, which I'm in my home office, but in my regular office, I have a magnet and it says, remember what is important to you. And it's funny because if it's important, you don't forget, right? But yes, you do.
You do.
We get distracted by so many things, and we're overwhelmed by a lot. And it's hard to stay focused on what is important to you. What are your values? And so for you working in the community, but also helping the people you're working with identify what is meaningful to you in your life? What and who is meaningful to you in your life? And along with that are your beliefs. We can have helpful beliefs or we can have unhelpful beliefs. It's really important to notice the helpful beliefs, the ones that really get you through the tough times, and you want to help bring those out in the people you're talking with. What pumps them up when they're feeling really low? And we like to say, what would a good friend tell you? And repeat that to yourself. Unhelpful beliefs, though, we all have them. We all have these unhelpful or negative beliefs. You're not going to get rid of them. This is not a talk about positive thinking, okay? But the important thing is to notice when you're having those unhelpful beliefs, those unhelpful thoughts. Notice that they're there, like Luz said, almost like that, right? The devil, right? Notice that they're there, and then refocus on what's important to you. And it's hard work to not let that get in the way. But I bet you all had thoughts today about what you could or couldn't do, and you went and did them anyway. I mean, did everybody wake up today and say, I can't wait to work? I mean, maybe, but so we've had negative thoughts or beliefs, and we do it anyway, right? Because it's important to us. So helping people to identify what those helpful beliefs are and those unhelpful beliefs are is very critical. And then remaining strong, like grounding. Writing it down can be helpful. What is important to you? What do you value? Do you value your health, personal growth, relationships, spirituality? You know, what are these things that are meaningful to you? And then within those areas, how can you be connected? We know it's so powerful. It's one of the core treatments for helping people with depression, for helping people with anxiety, with chronic pain, with diabetes, is knowing what's important to you, what you value. It will help motivate you through the hard times and help you make changes when changes might be useful. So we could go on about this all day, I think, Luz, but I'll stop.
Thank you. It's funny when you mentioned who's excited about work, and I was like, oh my God, am I a nerd? Because I was texting Michelle at 7 in the morning saying, oh my God, I'm so excited about today, just because we were going to do this. So I guess that's a value, right? And in the middle of the night, I was writing ideas and everything. But, you know, some of the knowledge that you gave us in our focus groups is 3 things that you highlighted that are so important to our communities. First one is if they have their families. Mm-hmm. So what do our families look like, right? And how can we do more of that thing to get our families stronger and better? Because with that, our mental health is gonna be better. The second one was work. Because our families like to provide the best they can for those they love. It is something about work that conveys love to our people. It's not just a paycheck. And I think, you know, finding out, right, what work does is more than work, right? Waking up with that, I can do it. And people do it 3 or, you know, jobs from 8 to 10, and I see them out there, and sometimes they do it with a smile. And the last one was God. Whatever religion, form, shape, you know, beyond religious affiliation is something that drives our community, spirituality and God. So how to do more of that and how to help people. You know, one of the things that we talked about is during this pandemic, you know, our faith, beliefs, and spirituality has been going up and down, you know, and sometimes it's like, well, I feel like God loves me today. Maybe not so much today. Maybe I'm angry at him. No, but I'm not supposed to be angry at him. Oh, I love him more than ever because I haven't gotten sick. Oh no, maybe I get to, and it's just constant back and forth, right? But how do we remain strong in those things that our communities love? And you're key in helping them find out what those look like.
And you're also key in helping them be creative, because right now you can't do all the normal things you usually do to keep in touch with what's important. So it requires a lot of creativity right now.
Yes. And this one is very linked to our values, right? Remember, in building on your positive qualities. And what I tell our people, our communities are very resilient. And I bet you they have been, many or most of them, through hell and back. So it's helping them remind them what has helped them in the past to survive their darkest moments. What is it? Because in that, they will know that if they survive once, they can do it again. They have what it takes to walk through hell and make it out, right? But sometimes, like Katie was saying, we forget. We're so busy. We're so stressed. We're overwhelmed. We're so tired that we forget to think about it. And you can do this. You can invite people about reminding, thinking of who they are, like I said, where they have been, what they have learned, and where they're heading. We have people with substance use disorders who have been able to overcome it. How did they do it? We have people who have overcome divorce. You know, how did they do it? Overcome violence, overcome trauma, overcome COVID. You know, what has carried them through that? And I think in helping people remind them, you're helping them build a stronger mental health and an ability to know that no matter what life throws at them, they'll be able to wake up in the morning and keep putting one foot in front of the other. And this in turn will help people develop a more positive self-image, right? So that they can start seeing themselves as, okay, I got this. Yes, it's not perfect, but I can do it. I will survive. I will make it. Another thing that is important is to encourage people to adopt healthy lifestyle. And this is when we need to be careful, right? Not to point the fingers, because we can say, you need to eat better, you need to exercise more. Well, we need to respect people for whatever they think is a healthy lifestyle. For some people might be build their spirituality. They don't like to exercise. It is okay. Maybe find another version of what is it? Is it dancing? Is it walking? Is it gardening? We heard from you that a lot of people have discovered new talents, gardening, cooking, painting. So in a way, you know, in the midst of all this bad thing, the pandemic has good in finding what are those positive talents or values and qualities or lifestyles that you can draw more to keep your mental health and to keep moving forward. Encourage people to do more of the things that they like doing. Of course, if they're healthy, right? Because if you're gonna tell me, Luz, keep eating your M&Ms, I'm not gonna tell you where I'm gonna end up by the end of the month. You know, but do more of those things that bring you joy, that makes you feel at peace, that makes you feel good about yourself. And like Katie mentioned this point, help people brainstorm, you know, new opportunities, what that looks like. You know, hopefully in this booklet that we want to put together, we'll have lists where people can fill out what that would look like. So next point is building stress management, Katie.
Yes, and I just want to go back to something you said, Luz, about doing more of what you enjoy. That sometimes seems frivolous, or it seems like, how can I do something I enjoy? I'm barely making through the day. I barely have enough money to help my family survive. It seems like fun or play. And we know, though, that it's critical to psychological health to do things that make you smile, to do things that make you laugh, to do things that bring you joy, even if it's just for a moment. And so you are in a very powerful position to give the people you work with permission to have fun, permission to laugh for a minute, permission to do something they haven't done in a little while, to do something they enjoy. So I just wanted to kind of repeat that, and how powerful a position you're in to give them permission. And that means you have to give yourself permission too, but we'll talk more about that next time.
Yep.
So, but stress management skills, so problem solving, helping people identify, like we've talked about, what is the problem? What are the barriers? What are some of the triggers? What are some possible solutions? And you're not responsible for coming up with the solutions. It's a discussion, right? Relaxation. We're going to talk about all these a lot more next week too, so don't worry, we're rushing a little bit, but we'll talk more about them. You've all shared this too in the feedback we got about how ways you relax. I saw some of this in the chat too. People pray. That helps. Doing art, like Luz said, activities, connecting with others, connecting with family, whatever your family is, whatever your definition of family is, your friends, being creative and doing that. All of these pieces, though, can really come together to help improve mental health. We're in the middle of this, when we're in the middle of this pandemic and dealing with other stress. So I'll leave that loose. I know we have a few more slides to get through.
Yeah, a few more, but we're in time, I think. The next point brings us to support system, right? Sometimes we tend to think that the more people I have around, the better, right? And that's not necessarily the case. So I want you to help to start people think about quality of support around rather than quantity. What are some of those sources? Where can people find the support? And what are some of those things that are keeping them away from finding adequate support that they need? Is it because they feel maybe they're just too tired, too fatigued to maintain, sometimes maintaining social relationship is really hard, for people that work all the time, having to listen to people when you're tired, having to talk to people when you don't have the motivation, sometimes it's very hard. So it's about discovering what that person needs and what can be the right time to engage in activities with other people. The other one is there's some people that are very shy and that have a hard time engaging in connections. So for those people who sometimes is a can't do, how can you help them build the skills to maintain social connections, particularly during these times that are so difficult? A common concern that we have heard from you is that people feel lonely. And it's very, very sad that a lot of the times we hear that people feel lonely in their marriage, that people feel lonely in their family. So what is happening? Why that is? And how can you help figure your people in the community how to make it work, how to create conversations that will build support, how to build, Katie talked to us about activities, how to create activities that we enjoy, and maybe we don't have to talk, because a lot of the times we talk and make things worse, right? How can we work together in silence? And a lot of the times you find joy, even if you look across the other person, if you're putting a puzzle together and you smile at each other, that's gonna make you feel valued. That's gonna make you feel like you have the support of someone. So I invite you to help people to first identify what are some of the types of support they need. These can vary. A lot of the times we need support that can help you get information, right? Or we need support that will help you provide with childcare. But a lot of the time we might need emotional support. We need someone to hold us, and we in the Latino culture, we need to be touched. We need to be hugged. Other than that, we feel like we're starving. And a lot of the times don't get it. So how come we don't have the freedom to go with our husbands or with our wives or with our children and says, I need a hug, hug me today. This is what I need. So how can we identify those support systems and how we can take little steps to make them stronger? And you are key in teaching our communities how to do this. Reminding people that they're not alone. Reminding people that there are ways to feel connected, and one of the ways to do this is to give to other people. Our communities love being collectivistic, they love helping other people. They love doing something, whether it's cooking for the neighbor today or giving a ride to someone. There is something about altruism that helps you build yourself up. So remind people how they can do that, but always with a framework that they have to take care of themselves first before they can take care of others. But we will talk more about this on Friday. And finally, Katie and I will walk you to a series of resources. This was a little hard to put together, honestly, because we have people, as you saw at the beginning of the session, from all over Texas. And the resources vary, by region, by place. So it's not, we wish we could give you a list of mental health providers in your area or centers that you can go, but it was very hard to do because we're getting bigger and bigger. However, we put some of the best basic tips, skills, and organizations in here. I encourage you to sign up. You're going to have all the slides, or you're going to have all of these links to sign up for all of these organizations and the newsletters, their local chapters. You're going to get a lot of information and start building your binder. Because when you start getting your bag full of rocks from the community, you're going to put one of those sheets from your binder and give it to the people to read. So start building those resources with everything and all of the resources that we're going to give you here. So the most important thing is identify those resources that you know people will trust. Read them. If they don't make sense to you, do not even pass them on to the community because they probably won't make sense to them. What do we do as professionals? We go to you for your feedback because you know what the community will understand. You will know what will resonate with the community. Do the same thing. When you're giving them or when you're sending them someone, make sure that that is a place that you will go. Make sure that that is a place or a material that you will read before you handing out to someone. Help people become protected from scams. Unfortunately, our people, you know, all the time are exposed to this, right? Whether when they're buying a house, they end up with bigger interest. When they're buying a car, you know, they're being read by immigration attorneys all the time and by legal systems. So what are some of those resources that can help people protect with scam? This is essential for mental health because there's no bigger blow than being taken advantage of. So that's another very helpful thing. And then here we have the resources. The first thing that we sat down and brainstormed about is where you can access them within your local communities. There's a lot of community health clinics. Sometimes, you know, try to go and knock their door and walk to the front desk and says, do you have any resources that I could take to the community? A lot of the time they'll pull out pamphlets and give them to you. But if you don't ask, you won't get them. Faith-based institutions, these have been saving grace to our communities. They have so many. They provide fairs, they provide workshops. So knock the doors of those faith-based institutions in your communities and ask them, do you have something that could help my people? In asking, you will get. There is medical, if you're lucky to live in a larger city or in a place where there's a medical or a dental school, also for the people in Del Rio, UTRGV is a fascinating mecca of resources for particularly the underserved communities that are living by the border. You know, go. I know sometimes it can be a little intimidated, but go. There's the departments of psychology, there's the departments of medicine, there's community health. A lot of these places have them, and ask for resources. Health fairs, you know, find out from your city or county government when are health fairs taking place in your community so that you can go and collect information and contact them. Sometimes hospital emergency rooms have a lot of pamphlets. So, you know, make a stop if you can to an emergency room and ask them, do you have any mental health materials or physical health or whatever needs, and put them in your binder, because that is going to be essential for you to help your people, to help them maintain the trust and to give them the resources to help them thrive. Community nonprofits are another excellent source. So find what are some of those. We're going to give you the names of some. And research studies and obviously the internet, but you have to teach people how to look at the right internet sites because there's so much information. So we're going to give you some of them. This is the link to the steps that we talked to you today about. This is the sheet that we put together with the National Latino Psychological Association. It's available in English and Spanish at this website. And it gives you a summary of everything that we talked today. So if anything, you can hand this out and give it to the people in the community that read it, and then we will talk about it.
Until we have the booklet, because that's going to take a little while.
Yes, yes, but the booklet is going to be so nice. Well, Katie, do you like to introduce us to the NIH webpage?
Sure, the NIH website is wonderful. I hope some of you are already, or all of you are already familiar with it, but you can click on all kinds of different topic areas. If you think somebody might have an eating disorder or they're having panic attacks or whatever is going on, you can look up the information and give a handout to them and inform yourself and them about it. So there's the sites there.
We also have the Reach Center where we belong, UTESCA. You know, if you click in our website, we have a lot of mental health resources in our page, and we'll be putting more. The video for the workshop today will be available for people. You know, those, we understand that people are so busy. So if you want to get credit, just contact us, contact Michelle, you know, and we'll guide you through the process so that you can have access to the videos and the materials. We also have the National Alliance on Mental Illness, the Texas chapter, but you know, if we have some other people from other states, look at your state and your chapter, go to their website. You know, they have a lot of, sorry, my dog is breathing. They have a lot of resources. And then we also have Mental Health America. I recently did a mental health panel for them, and they had fascinating information and resources. So go to the website and explore what they have. This is a page that Katie put together. You want to talk about it real quick?
I do. I hope everybody learns, or if you don't know already, this number and memorize it. It is available in Spanish as well. The suicide prevention lifeline, they say, not hotline. It's 24/7 anywhere in the US. And this is just a critical number to have in your phones and have available for the folks you talk with. Because I know you're on the front lines and you do meet people who are thinking about dying, they're thinking about killing themselves. Give this to everybody, because if it's not for them, maybe it'll be for a family member or for a friend. And then there's other resources here that I've come across. Everything's available in Spanish as well. Different hotline and more information that might be helpful during the pandemic.
If anyone in here today is interested in the presentation, this whole presentation and this whole resources specifically in Spanish, send an email to Michelle, because we have the presentation in Spanish and we'll probably be putting up on the Reach website so that you can have access to that. Unfortunately, we don't have time for the questions and answers. We want to be respectful of your time. It has been a joy, really, truly, to be here with you. We promise you we will get every single question that you sent us in the chat, in those videos for you. And we're going to send you one more survey, you know, and why we do this. And please, it's important that you answer it with the best honesty that you can, because this is the only way that we can get better, that we can bring you what you need, and that we're going to know how this works. So in 3 and 6 months, we're going to contact you again with a survey. Please answer it, because we want to know, did anything that we talked about today help you? What helped you? What didn't? What else you need? Without you, we cannot do our work. So in this survey that Michelle is going to send you, it's not as long as the first one. Some of the questions might be repetitive, but please take a few minutes to fill it out, because we need you. And finally, the last message is that our communities need you. So this is why you need to take care of yourself so that you can take care of others. And this is why we look forward to having you in our next workshop. Do you have any last words to say, Katie? And Carly, if you can please unmute people so that, you know, they can talk and say bye before Katie talks.
I just want to say thank you as well. This was really an honor, and I love working with our community, and this is like a big, broad community in Texas mostly, I think. So thank you so much. It's been wonderful. Looking forward to Friday. Very excited about Friday.
Yes, thank you, Michelle. Thank you, Raquel. And hopefully everybody's on mute.